Good afternoon, everyone. My name is Adil. I'm the MPP for Don Valley East. I'm our party's health critic, and I'm also an emergency doctor. And I wanted to reflect a little bit on that because it has given me an unparalleled insight into the indescribable value of nurses. Nurses are my friends, they're my family, they're my coworkers, colleagues, and they are my saviors. Because I know if I'm about to discharge someone from the emergency department that doesn't have a safe doesn't have a safe place to go, they're not going to let me discharge that patient. When I first started practice about 11 years ago as an emerge doc, I'm sure many of you have experienced the same thing. I was afraid to be the overnight emerge doc. I was afraid about the overnight shifts. And there's one thing that made it okay. I only took the shifts where Angie Panu was the charge nurse. Because I knew I could trust her judgment above my own. I knew she would help me manage the department, and she would not let me go astray. All of us have at least one of those nurses behind us, whether it is you and it's a nurse that was a mentor, me, a doctor that was afraid to work without that nurse, and most importantly, every patient in Ontario that has a nurse standing shoulder to shoulder with them and behind them to make sure that they are not led astray. Now, I want to congratulate all of you on the recent huge win that we had about Bill 124 finally being struck down. And I joined so many others in saying Bill 124 was wrong, was unconstitutional, needed to go. But all those times I was saying that, I had a second message. That second message was that Bill 124 alone will not solve the problems in our healthcare system, will not resolve the health human resource shortage. So I'll put this out even though I already know the answer. Who has ever felt unsafe at work before? Yeah. Who's ever been verbally or physically assaulted at work? There you go. Until we address the conditions of work, until we address the mental health epidemic in society, but in our profession, until we address the burnout, until we empower every single nurse and inspire every single person to become a nurse, then we will continue to have a health human resource shortage and therefore a healthcare crisis. We will see people not choose nursing. We will see nurses leave the profession, and ultimately, we will see patients not get the care that they need. And so this is my commitment to you. This is our commitment to you. To work with you, to work for you, to fight for your profession so that you can fight for all of us. So let's do these things, and let's do these things together. Thank you.